Assalamu alaikum wa rahmatullahi ta'ala wa barakatuhu. My name is Alhaj Abdul Wahab Isa, Naib Amir 2 and Afsar Jasa Salana. I have just come to make my donation of blood.
Assalamu alaikum. By Allah's grace, last year on our convention, on our Jalsa Salana, we were able to give almost 2100 unit to blood banks, and I hope certainly it will give benefit to many of the lives.
Ghana is investigating 2 suspected cases of the coronavirus. The 2 patients reported to a hospital in Accra with symptoms of the deadly virus and have now been isolated.
Even though it may be said that the number of our infections is still relatively low, if we act now, purposefully, we have a chance of preventing an escalation of our numbers.
COVID-19 has had a profound effect on virtually everything in our country, and the blood sector is not been spared. Really, we have been affected in terms of ensuring adequate blood supplies. In normal times, because we are in a new normal now, in normal times, more than 50% of our collections will be coming from educational institutions, from religious organizations, and from corporate organizations, institutions, and some community groups, apart from a few people walking into our centers to donate. But with the new normal, with COVID-19 pandemic, schools are home, the religious organizations are not operating, and of course, most corporate organizations, to ensure social distancing, have most of their staff at home. And this has been because of the ban on public gathering by the directive from the president.
With the advent of COVID-19, we had to, even at a point, go for a 2-week break to deliberate on the way forward, whether we could still continue to collect blood or we should wait for everything to be over. But you won't agree with me that patients need blood, and we can't wait for COVID to go before blood is given out.
It's been very difficult for patients who need blood urgently to get blood. All we do currently is allowing for family replacement, which is not enough. Majority of patients on the ward are unable to even replace what they take. Contract donors who are just few are not able to fill our blood banks.
Even with the ban lifted up, people do not want to come into the hospitals, to the blood centers, because most of our collections are around the country. Some are in blood centers, some are in hospitals. So it's really affected the collections. The demand is much higher than the supply. So being a responsible organization, what we did was to move from using mobile blood collection sessions, mass mobile blood collection sessions, to using appointment system. And it's coming up, but it's not the best because that has not been the norm. So we will call upon the general public, those who are fit to donate. It's between the ages of 17 to 60, male or female, if you heed to our call. I know that most people are also a bit scared now because they think COVID-19, can be transmitted through donation and transfusion. The good news is that it's not been proven anywhere that COVID-19 can be transmitted through blood donation or transfusion. If any, it's theoretical. So what we have done is to put in some precautionary measures, and it's mainly precautionary.
That's the reason why we are building Walla, a digital platform for donation, processing, and delivery. Walla is connecting multiple hospitals on one platform, and the donors who are on Walla platform will be directed to their local hospital, and when they get there to donate, they will receive a digital token from Walla after donating. And with these digital tokens they receive, they can exchange it for a free medical checkup.
I therefore appeal to all voluntary donors and the new donors and to the general public to walk into any of our blood banks, to donate blood, to save valuable lives.
I think we should be each other's keeper at this time. Our focus has been on COVID. The need is there. Somebody needs blood to live.